Well, education is basically the, what shall I say, foundation for, in the end, in the long run, achieving good outcome for patients. So for me, education is the most important factor to have reliable doctors, reliable work being done for the community. I think for the participant, it's like a sort of a rounded up version of the whole knowledge base they need in a very, very short time, of course. You can't show them everything, but they can profit a lot. Yeah. The part I enjoy the most are the discussions where we can interact. Sometimes you have experienced surgeons here, sometimes you have beginners, so there's a whole variety of questions. You sometimes get challenged. So discussions I probably like the most, and the practical part is good too. Yeah.